Good morning. We are here for a very important lecture and a very important theme, that is understanding heart attack. So today we are going to discuss about understanding heart attack. We have all seen the movie Titanic, a great movie. Titanic was a ship which people thought cannot sink. And about 100 years back, this ship, which was thought to be unsinkable, sank, and with it went down 1,500 lives. 1,500 people were drowned in the sea. And decades later, a movie was made named Titanic. It was a hit. It was the best movie of the century. But people wanted to know what happened, how it happened, why it happened, could it be prevented? And today, it is equally important that the heart disease is taking much more lives than the Titanic, but it is less talked about, less movies are made, and there's less awareness. Today, millions of lives are lost. It is seen that in the statistics of 2019 showed that 17.9 million people, they died of cardiovascular disease, and a majority of them, 15.2 million, they died due to cardiac or stroke, that's cerebral and heart problem created by the cardiovascular disease. Problem is still the same. We still have the same questions like we had for Titanic. Why it happened, what happened, how it happened, and how we could prevent it. There are same questions which are still present, still we want to have the answers. Luckily, the American Heart Association has said it is a fight that we can win. There are some small steps which can be taken by which we can win this battle against the heart disease. But the first step is awareness. We must know what is heart attack, how it is caused, what are the possible options for treatment, and how we can prevent it. Because I personally believe that the more a patient knows about the heart disease, the more he knows about his disease, the more he can help himself. And that is what is required in our country. Now about the heart attack, before we come to heart attack, we should know what is the heart and about the heart. The heart is a pump in our chest about the size of our fist. If I ask you what is your age, you will calculate from the date of birth till today. Now if I ask you what is the age of your heart, let me tell you, it is about 3-4 months more than your actual age what we mentioned. Because the heart starts beating at around 6 weeks. So our heart life is more than what we think our life is. And since that time, it is beating continuously, average 72 times a minute. That comes to 1,03,680 times a day. And in average lifespan, if we count at 70, it is going to beat around 50 crore times in your lifetime. And it is going to beat non-stop. And we also have to keep in mind that when the heart is beating, at times more oxygen is required, like when we are going to exert ourselves, we are going to run, we are going to walk, we are going to exercise, that time the heartbeat is more. And the blood which is pumped is 5 liters of blood every minute. That is 700 million liters in our lifetime. And when we want to exert ourselves, this demand goes up. And the heart is able to do 6 times as much work as is normally being done when at rest. The purpose of the heart beating is to supply blood throughout the body. Every organ in our body requires blood, and the heart is responsible for supplying that blood to every organ. Of course, when the heart is supplying blood to the whole body, it also requires blood for itself. So we have the supply system with which the heart gets its own blood supply while also supplying blood to the rest of the body. For this, we have the coronary arteries. We have one artery on the left, which is known as left main. It divides into two, the left anterior ascending and the left circumflex. And separately, a right coronary artery is there to supply the blood to the rest of the heart. What is important is this blood supply to the heart, these arteries which are supplying to the different part of the heart, all the muscles, they have a network among them. So if the blood in one artery is blocked, the blood from the other arteries, the small microcirculation is linked and it reaches that area. I'll just give you a simple example of that. I am in Ludhiana in civil lines. In Ludhiana, different areas have got different tube wells to supply the blood supply. And at some place, they're all interlinked. So if the water flow is not there from the civil lines tube well, we will get the blood supply from some other tube well which is linked with us. Similarly, the heart is the same. We have got the three main blood vessels, and the small blood vessels, their small capillaries are interlinked. So if there's less blood flow from one side, the other takes over. We'll come later to what is the importance of this. What we think is that with age we get blockages. What I say is that blockages start developing from the day we are born, and they keep increasing. What happens is that as the blockages increase, the body's collateral circulation also starts increasing. And gradually, the balance is maintained. One side the blockages are increasing, the other side the capillaries, the collaterals are increasing, and a balance is maintained. As long as this balance is there, a person will not get angina, he will not get a heart problem, he will not feel anything. But when this balance is not maintained, that is the time when symptoms start and the patient starts having the heart problem. And it is seen that up to 70% blockage, normally the body is able to adjust itself. That is what I will say, the nature's way of treating us. But when the blood flow decreases, what will happen? When it decreases, like if you don't give a child food, he will cry. And the cry of the heart is the angina. So if the blood flow decreases, the heart will cry for oxygen, cry for nutrients, and that is angina, and the patient will feel the discomfort. If the supply is completely cut off, then some part of the muscle will die, and that is heart attack. So you must understand there is a difference between angina and heart attack. They are not the same. Now, what are the factors which cause the heart disease? Now, what are the reasons we get the heart problem? I'll say what are the risk factors. There are two types of risk factors. One is the modifiable, the other is the non-modifiable. We'll come to the non-modifiable first. We can do nothing about them. That is the age. As we grow older, we have more heart problems. Sex, it is seen that the males have more heart problems than females, but in the elderly, it is almost the same. And hereditary, it is passed on in the generations through our genes. But about all these three things, we can do nothing. We cannot stop our age, we cannot change our sex, and we cannot change our parents. The other is the modifiable risk factors. These are something that we can do. We can do something about them. Diet. We need a healthy diet. We need a balanced diet. What I will say is that different places will have different concepts of what is a balanced diet. Someone who's living in Iceland, his diet will be different from someone who's living in India. Someone who's living in North India, his diet is different from what is in the South India. So, as a simple rule, what I will say is, eat something that is fresh, eat something that is grown locally. Once we have fresh and local, it is likely to take care of most of our food needs. Stress is a major factor. At one time, I started asking my patients when did they get the heart problem, and most of the time it was when they had a major stress. And unfortunately, most of the time it was when their sons asked to be separated, or they asked for a share in the property, or they said that, Papa, let us sell this house so I can do business. So this is a type of stress that is responsible for the heart attack. And I'll say the most important thing is stress. Diet, rich and poor, we can always make a change. But stress is something that is really very harmful. Blood pressure, we must take care of that, because blood pressure has different roles. It affects us in different ways. Blood cholesterol gets deposits along with other elements leading to the heart problem. Then we have the diabetes. Diabetes and blood pressure, they combine together to form a deadly mix. And anyone who's having diabetes, anyone who's having blood pressure, I assume that he is likely to have a heart problem as well. Overweight, obesity. Here, one thing is important, that everyone who is overweight does not have excess fat. It is important to understand whether the person's bones are heavy, muscles are heavy, or actually he's got excess of fat. So what we do is that we do a body composition analysis. Those patients who are overweight plus they have excess fat, it is those patients that we have to take care of as far as the weight is concerned. Sedentary lifestyle is something that has been handed over to us by civilization, and we must take care of that. We must be active as much as possible. We must exercise. If we have a routine in exercises, we don't require the gyms. We can always do it ourselves, walking, jogging, exercising, running. And of course, tobacco and alcohol. They are again very deadly, especially the smoking. The more we smoke, the more likely we are to have a heart problem. So smoking, I always say, should be cut down absolutely. And the good thing is, when we stop smoking, the changes which have been caused by years of smoking, they reverse very easily. So these are the factors which lead to the plaque formation. Now, how does the patient feel when he has a heart problem? I will divide it into three categories. One is a silent attack. Patient's having a heart problem, but he's not feeling anything. So these are the silent attacks, especially more in diabetics. Just today I had a female who has had a heart attack, as her ECG shows. She's diabetic, she's hypertensive, she's got hypothyroidism. Her ejection fraction is only 25, and she's never had any symptoms. So firstly, one possibility is a silent attack. Then we have the angina. Angina I'll classify into two, stable and unstable. Stable angina, the definition may vary from person to person. What I will say is, stable angina is predictable angina. Predictable angina means that we know that if I exert so much, I will get the angina. If I rest, it is okay. So we can predict that this much exertion is going to cause the angina. If I walk so much, I will get the angina. And unstable is unpredictable. It just comes even when we don't expect it. Other is the heart attack. As I said earlier, angina is cry for oxygen, and the heart attack is death of the muscle. In angina, we can have different features. We can have pain, distress, squeezing sensation, piercing pain, burning sensation. in the chest, in the arms, upper abdomen, jaws, neck, or upper back. Then we can also have nausea, vomiting, ghabrahat, what is normally the patient says, choking sensation. So all these are possible. Yes, what is important is if it is happening repeatedly, if a person is having acidity, don't forget to consider a heart problem. In heart attack, features are similar except that they are more severe. It is prolonged. Always consider heart attack as an emergency and never neglect it. So, first of all, we have to know what is it. Is it silent attack? Is it stable angina, unstable angina, heart attack, or is it death caused by these? Tests, some tests are always done to confirm. Of course, the clinical evaluation is the most important. So in the test, we start with the basic blood tests. Then we have the ECG. ECG, I'll say, is a simple test, safe test. We have the ECG can be of three types. One is at rest, one is during exertion, one is 24 hours. What we call the TMT or the Holter. It's a simple test and it's very good for screening. If positive, it is very reliable. If negative with symptoms, we should go ahead with the other tests. Then we have the echo, again a very simple test, very safe test, all done externally. In echo, it is an ultrasound of the heart. It can tell us which part of the heart is weak, is not pumping properly, or about the valves. Then we have a stress thallium. In stress thallium, an injection is given and gamma cameras take a picture and tell us where the blood is going, in which part of the myocardium, and where it is not going. The next very important test is the angiography. The angiography, again, an injection is given and the cameras take a picture and tell us where the blood is flowing. Angiography can be a CT angiography, which is very simple, or it can be in the cath lab. Now we are coming to a very important test, which is I consider one of the best tests available. It is non-invasive, without radiation, without injections, without any putting in any wires or something. A patient simply lies on the bed, sensors are attached, and the computer does the rest. Its accuracy is around 80 to 90%. We can come to know which part of the myocardium, which part of the heart is getting how much blood supply and how much deficiency is there. We also come to know with this test how much oxygen totally the heart is getting and how much is being used and how much there is for reserve when we're going to exert ourselves. This is another very important feature that we get from this test. That is the thrombus formation factor. What is the chance of the blood clotting? Because it is the blood clot which is actually causing the heart attack and not the narrowing. Then we know the burden. It is not just the decreased blood flow. There can be excess volume of fluid volume in the body, which can cause burden on the heart. It can be decreased blood flow, or it can be blood pressure. So we come to know how much burden there is and how much. Then it is also important to know what is the arterial elasticity. As we grow old, as the disease progresses, the elasticity decreases. We want to know the rhythmogenicity of the heart. What is the chance of the heart rhythm going wrong? When there is decreased blood flow, there is gradual problem. When there is rhythm effect, there can be sudden death. So this test also tells us what is the chance of sudden cardiac death. So this was about the cardiovascular cartography. This is another test which can be very important in future. It is being used in very less places. It is a simple microscope in which we focus on the nail bed and we can see the capillaries. And with this simple test, which is not at all expensive, the microscope used for this is also not expensive, we can come to know about the circulation in the nail bed. And this circulation is a representation of the circulation rest of the body. Now, treatment, first of all, we do is the medicines. There are some basic medicines which I won't go into details, which are used in case of heart attack or angina. Then we have the angioplasty. In this, a wire is put in, and with a balloon, the artery where it is narrow is dilated, and a spring is put in, which we call stent, to keep it open. So this is the angioplasty and stent. And then we have a bypass. In this, where the blockage is there, like when a city has got congestion on the roads, a bypass is created. Here again, the original blockage remains as such, but a bypass is created. I consider these angioplasty and bypass as excellent treatments in case of emergency. As primary, they are the best treatments. Other than that, we can also consider some other treatments. This is a new concept. This is ECP, external counterpulsation. In this, patient lies on the bed, and cuffs, like big blood pressure cuffs, are tied on the legs, and the new machines are also having on the arm. They compress sequentially with the timing based on the ECG timing. And their effect is that they increase the pressures in the coronary arteries, with which the small blood vessels, they dilate and become bigger. The dormant blood vessels which are there since birth but did not open up, they open up, and new blood vessels formation is stimulated. So the heart muscle can get more blood supply. What I'll say is that they are natural bypass. That is what the nature is gradually doing. When the blood flow decreases due to blockage with age, the nature is trying to compensate. And this does the same thing. So it is an excellent treatment, non-invasive, and without any surgery. And it is now mentioned in Harrison's textbook, Braunwald's, Hurst, and many other textbooks. This is another treatment which has now come up. This is a German technology. In this, ultrasonic shock waves are given to the myocardium, focused with the echo. And when these are repeatedly given 9 times, it is seen that there is formation of new blood vessels over there. This again, there's plenty of evidence to show its effectiveness. Then we have another treatment known as chelation therapy. In this, intravenous medicines are given to remove the calcium and heavy metals with free radical load coming down, and with the increase in the elasticity of the blood vessels, the blood flow to the myocardium is increased. Again, there is plenty of evidence of this. Lifestyle is, of course, number one. Whatever treatment we may take, lifestyle should be added on. And all these treatments can also be part of the cardiac rehabilitation after the stent or after the bypass. Now, how do we know that patient has improved with any of the treatments, with angioplasty, bypass, ECP, ESMR, or chelation therapy? The patient's medicines decrease, his SOS soft rate decreases, he can walk more, he can walk faster, he can exert more, his quality of life is better. Other than that, we can do the cardiovascular cartography test to see the improvement, or the stress thallium, TMT, or of course we will not like to repeat the angiography for this. The best test, which I always say, is what the patient feels, how how better he is feeling. But remember, the most important thing is prevention. There's nothing to beat prevention. Like Dr. Abdul Kalam said, that there is a role for every treatment, and we should gradually move up from lifestyle, diet, medicines, to non-invasive treatments, and if required, ultimately to the invasive treatments. Thank you. Thank you very much. I am Dr. Sibia from Sibia Medical Center, practicing non-invasive cardiology and all these treatments, non-invasive treatments, for the last 25, 30 years. Prevention is the best, and after that, all the others. So best of luck. Wish you good health. Thank you.